Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Pho, founder and editor of KevinMD. Today on the show, we have Eric Rafla-Yuan. He's a psychiatrist and he co-wrote the KevinMD article, A Southern California Outbreak Highlights Failures of the American Healthcare System. Eric, welcome to the show.
Thank you, Kevin, for having me.
So we'll get into your article in a little bit, but first off, can you share your story and your journey to where you are today?
Sure. So I am a psychiatrist in San Diego. Like you said, I'm a recent graduate from the UCSD psychiatry residency program. But one of the great opportunities I had there as throughout my training is to get invested in the community settings. So really looking at the public health sector and how our communities are served by the healthcare system. And then specifically what I've really been passionate about is looking at how our immigrant and refugee communities, what we can do to help support them.
Excellent. And how is the pandemic affecting you and your practice?
My practice is just getting started, but because of the pandemic, everything is now 100% online, which fortunately telepsychiatry is one of the easier specialties to do that with.
And is there anything that you've learned over the past few months doing telepsychiatry that you could share with the other clinicians who may be listening to this podcast who also may be seeing patients virtually?
So I had the fortune of seeing patients through telepsychiatry before COVID-19, and so it wasn't as big of a transition for me. I think some of the biggest lessons that I've learned are more about how to navigate some of the logistics rather than the actual clinical encounter. So once you get into the flow of it, it's more or less mostly the same, at least for psychiatry. Obviously, some physical exams, things that are different. But navigating how you're going to contact them, what do you do if there are issues with the connection? Do you have a phone number to contact them? What if there's some escalation needed and you need to get to the hospital? How do you arrange all of that kind of thing? You're not there in your office.
So let's get into the KevinMD article that you co-wrote, A Southern California Outbreak Highlights Failures of the American Healthcare System. Now, for those who haven't read your article, can you share the story behind it and walk my audience through it?
Sure. So here in San Diego County, we're bordered to the west by the Pacific Ocean, to the south by Mexico, and to the east by Imperial County. And then Imperial County shares that border with Mexico and with us, and to the east of them is Arizona. So it really is in the desert. And it's one of the more rural communities in California. There are less than 15 psychiatrists in the entire county. They don't have a single psychiatric hospital. One of the things that we saw in Southern California was that cases of COVID-19 were sharply increasing in Imperial County. And initially some public health experts had thought that some of the more rural counties might be more spared because of it's easier to social distance and population density isn't as high. But really what we saw in Imperial County was an alignment of previously existing public health vulnerabilities that led it to its situation where COVID-19 was really rising more quickly there than anywhere else in the state.
Now let's get into more detail. What were some of those specific vulnerabilities that existed before the pandemic?
Sure. And so the highlight of the article is really to look at these specific things and show that this doesn't really have anything specifically to do with COVID-19, but these all pre-existed and are all inherent to the American healthcare system. So one of them is the healthcare infrastructure, which includes mental health infrastructure, is much less developed in rural communities. Rural communities have less access to medical care of all kinds, including specialists, and in this case, COVID-19 testing and treatment. Another thing that we saw is that rural communities are more likely to be disenfranchised in a number of ways, socioeconomically. Imperial County as well has a large number of immigrant families and community members, and these communities have been targeted by the current federal administration in a number of ways, including ways that would disincentivize them or penalize them for seeking out COVID-19 testing or treatment.
Telemedicine has been advocated as one way to increase access. Now, are you seeing that as a potential solution to the immediate problem?
So telemedicine has been utilized by Imperial County and other rural areas, especially in California, for quite some time now. So in fact, UCSD, where I work, collaborates with telemedicine support in multiple specialties with the main medical center in Imperial County. So that has been pre-existing COVID-19. Telemedicine is also being advanced now specifically for COVID-19 support. So, for example, UCSD has been involved in telemedicine endeavors with hospitals in Mexico, where their ICU staff or volume just isn't what, they don't have the infrastructure that we have in San Diego. So to help them develop COVID-19 protocols and such. And then, but in terms of the actual ICU patients and bed numbers, so telemedicine obviously isn't able to do much with that, which is one of the big issues in Imperial County.
What are some of the policy solutions that can address these issues? And knowing that policy sometimes takes a little bit of time to implement, what are also some immediate solutions that we can implement to help with these problems?
Yeah, so you're definitely right that policy tends to be complicated and takes some time because there are so many factors to consider. Part of the issue in healthcare policy is that it's tied to so much, and so it's hard to make a substantial change without changing a larger system, but that larger system is really consistent. But looking at the individual vulnerabilities, so some of the more simple ones would be policies that didn't penalize community members for seeking out care or treatment, especially in the case of COVID-19. Example, so the Trump administration's push for a public charge policy, which would penalize people for utilizing public benefits, really disincentivizes people to seek out testing and treatment, which they're congressionally entitled to. So that would be a simple change, and would be a simple executive order from the president or the attorney general. In terms of looking at how healthcare infrastructure is developed in rural counties, so that would be something that would need effort at all levels, both the state and the federal and the county level. But I think that's something that the CDC director has talked about, is that public health infrastructure is not where we need it to be, and that's been underinvested in this country for many years.
Sure. We're talking to Eric Rafla-Yuan. He's a psychiatrist, and he co-wrote the KevinMD article, "A Southern California Outbreak Highlights Failures of the American Healthcare System." One of the things that you mentioned in your article was divorcing healthcare from employment. And can you tell us how that can potentially help?
The United States is the only country in the world that has large proportion of the population where healthcare is dependent on employer. And that grew out of more or less what is like a quirk in World War II, where salary increases were frozen, and instead employers offered various other benefits, one of them being health insurance, and then this kind of snowballed into what we have today. But as we are now seeing, when people lose their jobs, then they lose their health care, and this is an issue when there's a pandemic, and many people are losing their jobs, and the last thing we want is for people to not have health insurance and not have the ability to get testing or treatment for COVID-19. Most other countries don't have this issue because their health insurance provision does not come through employment, but rather comes through public sector or by private companies. And so, but again, this is something that would need a coordinated effort from the federal and state administrations.
So in the upcoming election, if we end up with a Biden administration, he's proposing to strengthen what we currently have with the Affordable Care Act. And in your view, will that be enough to address some of these issues going forward?
Yeah, so there's obviously a lot of details to be worked out in terms of what president's proposing, or the presidential candidates are proposing, and what will actually be enacted into policy. But I think that anything that we can do that would increase healthcare access to citizens of this country and residents of this country would improve our ability to increase access to testing and treatment for COVID-19, which would end the pandemic sooner in this country. And I think that's what everyone wants.
And my final question, Eric, do you have a take-home message that you want to share with the KevinMD audience?
With COVID-19 striking the United States pretty badly and striking some communities worse than others, it's not necessarily because those communities are genetically more predisposed or something about those communities sort of from like a medical or biological basis makes COVID-19 more severe there. But really from a public health perspective, these are all communities that we could have mapped out and known that they're going to get hit harder. And so if this is the case, then if we already know this information and we know that there are things we can do to work with this information, then that's something that we need to invest resources in. Because if there are communities in our country where COVID-19 is continuing to ravage through the community, and it affects all of us.
Fantastic. Eric, thank you so much for sharing your time and insight. Thanks again for being on the show.
Thank you for having me.